what is the pathophysiology behind depression? Serotonin is a hormone that produces joyfulness. Studies show that low levels of serotonin hormone causes depression. Some advanced research says that low levels of vitamin B12, folic acid, vitamin B6, vitamin D and selenium can cause depression in human beings. So, as we have discussed, low levels of serotonin cause depression. So, we have to take foods rich in serotonin hormone. Now, we can see which are the foods rich in serotonin. As a whole, we have to take fresh fruits and vegetables, whole grains, low fatty foods, olive oil, the foods which are rich in antioxidants, and also low fat dairy foods. Now we can see which are the foods which are rich in antioxidants and have high amount of serotonin. They are beta carotene rich foods which include apricots, broccoli, carrot, pumpkin, sweet potatoes and spinach. You have to take vitamin C rich foods and high amount of serotonin which are lemons, blueberries, broccoli, strawberries and tomatoes. Vitamin E is a powerful antioxidant. They are nuts, seeds, vegetable oils which includes olive oil, kiwi and avocados. It is shown that low levels of vitamin D can cause depression. So, we have to take vitamin D rich foods. Of course, sunlight is the most important source for vitamin D. So, exposure to sunlight is necessary. In addition, we can take vitamin D rich foods like milk, beef liver, egg yolk, fishes like tuna, salmon, mackerel. Also, vitamin D tablets can be taken. The foods which are rich in serotonin and dopamine, which is affected by protein intake, are beans, peas, eggs, meat, yogurt and soy products. Vitamin B12, folate level and B6 level influences the level of depressive episodes. So, we have to take the foods rich in vitamin B12. They are fishes and green leafy vegetables. Some studies show that if the level of selenium in the body decreases, you can get depression. So, which are the foods which is rich in selenium? They are oatmeal, beans and legumes, chicken, turkey, Brazil nuts, oysters, clams, brown rice and also saltwater fishes. The other antioxidants that reduce depression are green tea, chamomile tea, dark chocolate, pumpkin seeds, chia seeds and also flax seeds. Some studies show that people who eat 1/4 cup of walnuts every day showed 26% lower depression scores. So, it is necessary to include walnuts in our diet. It is shown that omega-3 fatty acids rich foods cause decreased depressive episodes. We have to take fatty fishes like mackerel, sardine, salmon, tuna, also dark green leafy vegetables, soybean oils, vegetable oils, etc. Because omega-3 fatty acids reduce the inflammation are the building blocks of brain. So it causes decreased episodes of depression in the patients. Now we can see what are the foods to be avoided to prevent or reduce depression. Research shows that alcohol is associated with triggering or worsening depression. It is a depressant after all. It affects the nervous system, also affects the sleep. Thus, it causes depression as it reduces serotonin. Moderate amounts of caffeine can boost or elevate mood because it acts as a stimulant. If in excess, caffeine can cause stress and depression as it affects the neurotransmitters and is one of the contributors to poor brain health. So, it is better to avoid coffee and caffeine-rich foods, also alcohol. The other foods which have to be avoided are refined sugar and added sugar. This is because increase of blood sugar can provide irritability and promotes inflammation in the brain. Studies show that people who take more than 65 grams sugar daily were 23% more likely to develop depression. Also, processed foods and fast foods have to be avoided because these foods are highly inflammatory and can alter mood swings, causing mood disorders like depression. Coming to the psychological treatments for depression, they are cognitive behavior therapy or CBT, interpersonal therapy or IPT, and behavior therapy. In this, cognitive behavior therapy or CBT is one of the major therapies usually used for depression. In cognitive behavior therapy, the psychiatrist helps the patient to monitor and change the negative patterns of thinking, improve their coping skills, and thus help the patient cope with life's stresses and conflicts very easily. What are the lifestyle changes to prevent depression? One is exercise. Exercising regularly can boost up serotonin, endorphins, and other feel-good brain chemicals. Another, adequate sleep. Sleeping for 7 to 8 hours a day can prevent depressive episodes. Another is social support. Try to make regular contact with the family and friends to prevent the depressive episodes. Yet another lifestyle change is stress reduction. Try to manage the life's stresses by involving in other activities like hobbies, sports, games, etc. Yet another important is nutrition. Keeping a well-balanced diet and taking small meals throughout the day help to keep your energy up and minimize the mood swings. Now we can see what is the general management for depression. Family members and members of the society should always ensure a positive environment for the depressive patient so that he can improve the symptoms very fastly. It is always better not to leave him alone in the home, but to take him out to socialize with others, for example, family members and relatives, and help him to mingle with them. In case of children, if there is depression due to sudden loss of parent or sibling, it is better to shift them to a positive environment where there is more passion, love, admiration, which he or she lacks now. In case of young adults, if they fail to appear in exams or interviews repeatedly, in no way should family members or relatives blame them, but encourage them positively to reappear for the same. Otherwise, direct them to more interested career streams. What is the role of homeopathy in depression? There are effective medicines in homeopathy for treating depression. Acute depression or minor depressive disorder caused by death or separation of loved ones can be completely cured by homeopathic medicines. Chronic depression or major depressive disorder can be managed well by homeopathic medicines, and the patient can live a relatively normal life. So far, we have discussed about depression. Hope you have understood the topic. However, if any further queries or clarifications are needed, you can add in the comment box or drop a mail. Accordingly, we can discuss in the upcoming videos.